Hello, I'm Dr. Ian Strawford. I'm a cosmetic doctor and I'm the medical director of Skin Excellence Clinics. Do you hate your neck skin aging? Are you starting to see lines and wrinkles and that leathery texture? Maybe you're getting lots of laxity of the neck and it's just hanging underneath the chin there. You really hate your neck. Or are you worried that your neck seems to be aging much more than your face, or you've had some treatments in your face and you're really happy with how the skin and the treatments are working there, but you're now much more self-conscious about your neck? Or are you at an age where you're thinking, I can see these changes coming and I know what's coming, my neck's going to be aging. Is there anything I can do about it to slow that down? Well, at Skin Excellence Clinics, we might have all the answers for you.
Dr. Strawford, how does the neck skin age and how can it be different to the facial skin aging?
So neck skin can be very different to the facial skin. It can differ from men and women. Firstly, we're born with a certain amount of fat beneath the skin in the neck, and obviously that can change as we age. Certainly if we put weight on, then we can get a much more fullness and stretching of the skin, and the skin can age much more in the way of laxity in the neck skin. But equally, we can have very little fat underneath the skin in the neck, and as we age, we lose that fat. And then the skin is much more attached to the muscle, called the platysma muscle. And then with aging of that muscle, then we can get the bands called platysma bands that are pulling the neck skin, stretching the neck skin, and creating these vertical bands of skin in the neck. We often see horizontal lines, and then we can get lines and wrinkles. We may even get redness, inflammation, even pigmentation due to the aging of the skin. And lots of factors affect that aging of the skin, the sun being probably the biggest one. And I think many people will agree that often the neck is the forgotten part of our body when it comes to sun protection. We might be very good at putting sun protection on our face, and maybe even on our body, but often the neck gets forgotten. And certainly the neck becomes a real target to the sun if we love sunbathing or we use sunbeds. You know, when we're horizontal, we're going to get a lot of night on the neck. So I often see a lot of age changes in the neck skin that are related to chronic sun damage, chronic sun exposure.
What treatments can reverse skin aging?
So we have many, many treatments to reverse skin aging. I will say that it's never a quick and easy fix when we're treating the neck skin. Often when we're presented with treatment to the neck skin, we're actually starting to treat at quite an advanced stage. And we might need to use a combination of different treatments to try to reverse some of that skin aging and improve the quality. So it depends on the problem. So if we're dealing with predominantly laxity of the skin and we have maybe excess fat, then we might be looking at a FaceTite, NeckTite procedure. We might even be sucking out some of the fat and tightening the skin, or Morpheus 8 and those needling treatments that are delivering energy beneath the skin to cause it to tighten. Or we might even use a thread or two, a thread lift in the neck to hold that skin back. If we're dealing more with skin that is thinning, there's lots of lines and wrinkles, there's lots of sun damage, then we need to really rejuvenate and regenerate nicer, healthier skin. We'll often combine treatments of collagen stimulators. So I'm injecting a product now called Julaine, which is directly a long-acting collagen stimulator that's injected into the skin of the neck, and it will actually build new collagen over a period of time and can give results for several years, changing the skin of the neck. We often use polynucleotides, PRP, microneedling, heat and energy treatments like Tixel and Morpheus 8. All of these can be used individually or in combination to rejuvenate the skin of the neck. And it's really important, to come and have a consultation and discuss really the options that you have and how we can change the skin, and we'll explore those options with you.
What can I do to prevent or slow down neck skin aging?
So how can we slow down neck skin aging? You might be in your 30s or 40s and you've still got pretty reasonable skin of the neck, but you're worried it's changing, it's going to get worse with age. So I think one of the most important things I say to all of my patients is don't forget the sun protection in the neck. And the skin of the neck can be quite responsive in the early days to topical serums, antioxidant serums, and then we have a whole range of topical treatments that you can use on the neck skin. They can be very similar, but often they're different to the products we might use on the facial skin. And one of the biggest things I think can help slow down aging in the neck is if we have a slim neck, we don't have a lot of fat, but we have a lot of nice skin, and we'll start to see the activity of this muscle called the platysma muscle in the neck. And if you grimace or clench your teeth, you'll see that muscle working. You'll see with aging how that muscle will start to pull on the skin and stretch it. It will also pull down the muscle, the skin of the face and across the jawline. And we're starting to see a loss of definition along the jawline and a laxity of the skin in the upper part of the neck. We might even start to see these things called platysma bands, which are bands of skin. And when you contract that muscle, you'll see those bands being pulled down by the muscle. And this is where Botox can be really useful. So I think one of our tools is to inject Botox either into the platysma muscle or the bands, or we do what's called a microtox procedure, where we inject tiny amounts of dilute Botox into all of the skin of the neck. And that relaxes that skin. It relaxes the platysma muscle. So that can start to immediately reduce lines and wrinkles and also help with the platysma bands. It also can allow the skin to lift a little bit along the jawline. It's called the Nefertiti Lift. So I think one of the first things people can start considering to use in the neck, other than treating the skin with topical products, is to consider whether you're a suitable candidate to start having Botox in the neck.
What is the age I should start having treatments to my neck skin?
So we're getting an increasing number of younger patients coming looking to potentially have treatments for their neck skin. This is more of a preventative thing. And this is like they are becoming much more aware of the aging process of their face and now their neck, and they're looking to sort of slow that down. So this could be somebody typically in their 30s or early 40s, who may be showing signs of developing platysma bands or overactivity of the platysma muscle. They may be starting to get a little bit of laxity in the upper neck. They may be starting to get some lines and wrinkles developing. So I think when we're starting to see those changes, it definitely is a time to consider having treatment. But why not consider having some, or certainly be assessed by us to see if we can pick up those first changes that are happening before you see them. And that might be a time to start some treatment on the neck, such as Botox.